We have today a wonderful opportunity to listen to Dr. Sam Basta. And the audience is a wonderful variety of some of you who have been with us for several of our webinars. This is our 8th. And some of you who are just joining us, and we hope you continue to participate. I'm Andrea Simon. I'm a corporate anthropologist, and I'm president of Simon Associates Management Consultants. We specialize in helping organizations change, and about half of our clients today are healthcare organizations adapting to the changing healthcare environment. My guest is Dr. Sam Basta, who's founder and president of Healthcare Innovation by Design. And I will tell you a little bit more about Sam as we get into the presentation. But it truly is a pleasure and a privilege. I met Sam through LinkedIn, in fact, and I went down to Virginia to meet with him, and he's got some wonderful things to share with you for today. A bit on the series. Those of you who have been with us for several of them know that Trends from the Trenches has been an effort on my part to give experts in the field an opportunity to share what they see happening. So Chris Barlow spoke to us at the beginning on what's happening in physician relations, which you can well imagine is changing dramatically. And Diane spoke about branding and rebranding. Linda McCracken was really looking at big data from Truven Analytics perspective and how it's being used. I spoke a lot about the front and back end of innovation, and I'll tie that together as we go through today's webinar. Margie Davino had a wonderful presentation on how she, as a lawyer, is seeing healthcare reform taking place and how doctors are valuing their practices. And Ben Dillon was our last speaker, an e-evangelist, an e-health evangelist, and he had some new research that was really quite eye-opening. About 30% of searches today are online, and 42% of all the hospitals are redesigning their websites. Why Trends from the Trenches? As an anthropologist, our training is observational research. We realize that most people really can't tell you what they're doing or why. And until you watch what's happening, you hang out, you do undercover boss, you see what's going on, you can't really understand it. And so what we decided to do was use this webinar format as a way of sharing what people that we know are seeing as we are as well. And this was given to me by a client, and I thought it captured the job so perfectly. The real voyage of discovery consists not in seeking new landscapes, but in having new eyes. And that's what this is all about. So, the challenge for the brain is that we don't see things as they are, we see things as we are. And at the end of the day, if you're not seeing things changing, you're not seeing what's happening, and you're projecting onto it a way of keeping yourself in place. Our clients often are looking at things with such an abundance of information that they can't figure out what to do with it. They go into the paradox of choice. Too many choices make no choices. So our job is to help let you see, feel, and think in new ways and convert those ideas into big innovations, which is why Sam's talk today is so incredibly perfect. Healthcare delivery and experience innovation, a core competency for integrated delivery systems. Sam is a founder and president of Healthcare Innovation by Design. He'll tell you more about the numbers of people who are joining him on LinkedIn through this wonderful program. He's Senior Medical Director, Clinical Integration at Sentara Healthcare, one of the most innovative healthcare systems, and an Associate Professor of Internal Medicine at Eastern Virginia Medical School.
Hello, everybody. Truly a pleasure to be with you today, and thank you very much, Andy, for this generous introduction. Thank you all for taking the time on this Friday afternoon to be with us today and to listen about how healthcare delivery and experience innovation is truly becoming a core competency, not just for integrated delivery system, but really for all healthcare organizations that are trying to deal with all the changes that we're seeing, and that's going to be some of our discussion today. Before we start, I just want to say, as Andy said, I have associations and relationships with multiple organizations, either by employment or in a consulting type of relationships, and I want to make sure that everybody realizes that what I will share today is my opinion, my perspectives, and does not really necessarily represent any of the organizations or institutions with which I'm affiliated. From a conflict of interest standpoint, other than Healthcare Innovation by Design and an investment in Apple Computers, which just recently, actually a few days ago, Monday, announced that they are making a big rollout of their health kit and their new app Health that will allow a lot of the technologies that we're going to be talking about today to be a lot more seamless. Other than Healthcare Innovation by Design and Apple Computer, I do not have any conflicts or financial interest in any of the companies or products that I will discuss today. Before we start, just want to tell you very briefly about Healthcare Innovation by Design and The reason that that is relevant will be clear in just a second. Healthcare Innovation by Design founded that in December of 2009. We currently have almost 8,500 members on LinkedIn. I know that a few of the names that Andy mentioned were attending today are actually members on our LinkedIn group. And if you are not, I would encourage you to check that out. Just search for Healthcare Innovation by Design on LinkedIn and you should find our group. We also have our standalone website, healthcareinnovationbydesign.com. Organizations that are represented in our membership included integrated delivery systems, academic medical centers, healthcare insurers, some pharmaceutical companies, venture capitalists, startup in the healthcare field. So really a lot of very diverse membership, but they all come together with a passion and interest in healthcare delivery and experience innovation. Our two main services that we offer our membership is our Healthcare Innovation by Design Pioneers webinar, which is a monthly webinar. And the reason that that is important is almost all of the slides that I will use today were slides that were presented by some of our presenters on the Pioneers webinar. And we've been, those webinars have been taking place for almost 3 years now, so we have 30 some of those. And I thought that really our speakers and our presenters have given a very good perspective on what's happening in the area of healthcare delivery and experience innovation. And I decided to use, 1 or 2 slides from each of the webinars that we had and put that together to tell a story about what is happening out there, both from changes that are happening in the healthcare field and also the way that healthcare innovation, both in the experience and delivery standpoint, are helping organizations deal with those changes as they're happening. Those webinars are, the recordings are available online, and if any of you are interested, you can get my contact information to Andy or email me at sambasta@healthcareinnovationbydesign.com, and I'm happy to give you access to those recordings. Our other main service that we provide is online courses, and they're 4-week online courses meant for those who are interested in learning more about healthcare delivery and experience innovation, and we are building those courses towards a certification that will be Certified Healthcare Delivery and Experience Innovator designation. I'll start with a summary. What is it that I'm going to try to share with you today? And it's really 3 simple points. The first is that there's a perfect storm, and most of you are probably seeing bits and pieces. Some of you might actually be seeing all the pieces that are helping bring this perfect storm to healthcare and all the changes that we're seeing. Sciences, technologies, and new regulation are coming together to change healthcare, I think, in a way that I have not seen in the over 20 years that I've been in healthcare, and talking to others who have been in healthcare even longer than I have. They say that the changes that we're seeing these days are really almost unprecedented. And to survive, this perfect storm of change, and integrated delivery systems and really all healthcare organizations need to develop a new core competency, which is innovation. And today we'll try to define what it is that we mean. Innovation is one of those terms that recently have become very popular, almost overused, and people mean a lot of things when they talk about innovation. So I will help define what I mean when I talk about innovation as a core competency. And then finally, integrated delivery systems that are interested in becoming quote-unquote innovative must systematically create the spaces, internalize disciplines, and create a culture of innovation to be able to be successfully innovative. We'll start by talking about the perfect storm. And some of the things that are happening and changing, I have not actually put on this list, and doesn't mean that they are not. It just means that I was trying to keep the presentation to a manageable size, and there are a lot of other things that are happening that would probably fit just as well on the slides. But the big ones that I see are sensors, social networks, big data analytics. The $1,000 genome, I think, is going to become a huge changer in the field of healthcare delivery. Cognitive computing, venture capital, and value-based reimbursement. And the way that I will try to talk about those things, as I mentioned, is that I will share some of the slides and some of the points that our speakers on Healthcare Innovation by Design Pioneers have shared with us. I will not continue to say that through the presentation, but you will see the title of the presentation and the name of the presenter from which those slides came at the top of each of the slides. Paul Kramer from Upstream talked about the sensorification of healthcare. And what you're seeing there on the screen right now is an iPhone and some of the Fitbits and other devices that have become very common at the consumer level. People are using to track data. And this data that's being generated by those sensors it used to be, healthcare generated. It used to be that somebody had to go to their physician to be able to, get their blood pressure or pulse. Not that long ago, we started by having some, consumer devices that measure those things, but now they're actually being measured by devices that we wear and that are tracking those things almost on an ongoing basis. It used to be that physicians made decisions when it came to medical diagnoses and treatment based on data points that maybe were checked every couple of months or sometimes even once a year. Now we have those data being generated thousands of times every day at the consumer level, and consumers are having access to this data, and they're trying to actually make decisions based on this data themselves. And they're also very much looking for a way to share this data with their physicians to help them to make those decisions. And this, this new technology that Apple announced earlier this week, as I mentioned, the Health Kit, is going to make this a lot more available and a lot more accessible to even more consumers and more healthcare providers. So I think the technology in that area is moving very quickly from a sensor standpoint. This is another image, or another screenshot from that presentation that Paul provided, and it shows a blood pressure machine that, again, somebody can use to measure their blood pressure multiple times a day if they would like. And the really big piece, this technology from a consumer being able to measure his or her blood pressure has been available for a while, but the really big piece here is being linked to, a smartphone where you can collect this data, trend this data, even be able to perform some analytics on it, and more importantly, be able to share it with healthcare providers, sometimes even with loved ones on an ongoing basis. The fact that this data is being generated continuously and being shared with people within somebody's personal sphere or even within their healthcare sphere, and increasingly so, I believe is going to mean a lot of change, huge change in the healthcare delivery and experience space. This, some of the slides as well that I have today will be from recent publications. So this here is from MedGadget, and for those of you who haven't heard of Alivecore, Alivecore is bringing this consumer level sensors and consumer level data generation to a whole new level. This is a device that is now over the counter, $200, and somebody is able to basically get a one lead EKG, it's a heart monitor, and they can get that as many times as they want in a day and whenever they want. This used to be very sophisticated medical technology. It used to need a prescription, and somebody needed to be trained to be able to do something like that, and it used to be reserved for people who had very serious heart conditions that needed to be monitored. And then even with all of that being done, the patient would have the monitor for a few days, at most for a month. And if we were lucky enough to be able to capture the piece of information that we were able to capture during that period, if it didn't happen during the month, then it was sometimes not even captured at all. But now this is a consumer level device that can collect that information. It is with somebody all the time because our smartphones are usually with us all the time. And for the bargain basement price of $12, somebody can, once they've collected this data, they can actually request that Alivecore, the company, send it to a cardiologist who looks at that rhythm strip and is able to provide an interpretation. Hugely disruptive. Actually, I have one of those devices and recently experienced something that I felt was a funny feeling. So I was able to get one of those rhythm strips, emailed it to my physician. I was able to interpret it beforehand as well, but I noticed that it was just some premature beats that weren't really very serious. But I was also able to email it to my physician, and within a few minutes, we both had access to what was going on. Didn't have to go in for a visit. Didn't have to get an EKG. Didn't have to set up with an event monitor so that I can keep that with me in case it happens again. I can capture it. I felt a funny feeling. I was able to, capture it right there and then, and was able to share it with my physician all within a few minutes. As I was doing that, I was really kind of reflecting and imagining how different that is from just 7-8 years ago that I was in practice. I've recently, as a medical director, have not been in active clinical practice, but I was thinking how different that is and how much harder it used to be to collect this kind of data, and now it's available from an over-the-counter consumer device, very easily shared with providers. Another sensor that's available out there that I think is going to have, a huge impact, and that was shared by Margaret Laws, who is the Director of Innovation for the Underserved program at the California Healthcare Foundation, is a company that they actually invest in, and it's called Propeller Health. It used to be called Asmopolis, and what that company creates is a sensor that attaches to asthma inhalers, and somebody attaches that sensor to their asthma inhaler, and then they go about their normal life, and when they feel like their breathing is not what it's supposed to be, they go ahead and use their inhaler, and immediately that sensor captures that the inhaler was used. It's able to capture through the GPS functionality on a cell phone where the inhaler is located, collects that data, and it shares it with the company, and you can see there on the side of the screen there is a map that is able to collect all of this data from all of the different individuals who are using this sensor with their asthma inhaler, and then they're able to put all of that using this big data analytics that we're talking about. They're able to put that on a screen, and they're able to find out if there are certain areas in certain geographies where asthma inhalers are being activated, and whether it's because of an environmental factor or whether it's because of change in season or whatever. They are able to almost in real time draw a map of where individuals who have asthma are having their asthma symptoms triggered. And this data is also being shared with the patient's physician. So if they notice that somebody's using their rescue inhaler more often than they used to, they're able to reach out to them and either make an intervention or bring them in for further evaluation. But in real time, a physician or a treatment team is able to monitor in real time how their patients with asthma are using their inhalers, whether or not they're using their rescue inhalers, and where are they using it, and what do they need to do to intervene if the pattern of utilization is different for an individual patient from what their normal pattern is. The next piece that I think is really making huge change in healthcare delivery is social networking and social apps. Individuals now can connect with other individuals. As Andy just mentioned, we connected on LinkedIn, so those social networks are making it very easy to connect with others. It's making it easy for individuals to find other individuals with similar interests. It's making it easier for us to stay in touch with our friends and family. It's making it much easier for us to share, again, information with them if we would like to do that. If we select to do that, we can share even healthcare information. And all of the social networking is resulting in some new insight and new discoveries. There was recently multiple publications and books that were published on the fact that some of the diseases that are very prevalent actually spread through social networks. And they don't spread through social networks just because they're contagious diseases. They found that if a friend of a friend is obese, or if the multiple friends of friends are obese, it is more likely that somebody could become, develop obesity themselves, even though there is no direct network, but direct link between them and between those individuals who are gaining weight. So there's a lot of research that's happening now about how those social connections, even 2 and 3 degrees separated, can result in some of the diseases that we are experiencing as a society and that are increasingly becoming more prevalent. In the MIT Technology Review about 8 months ago or so, there was a publication that talked about a new type of medicine that is showing up in society now with the increased social connection through social networks. And it was what they called peer-to-peer medicine. And what the peer-to-peer medicine is really patients coming together and sharing information, and in some cases even conducting research without necessary involvement of healthcare professionals. And in the bottom of the screen there, you can see a table with some of those sites. Some of the ones that are more well-known are PatientLikeMe, where they have almost 220,000 members. PatientLikeMe had a very interesting discovery and a very interesting trial that they ran a couple of years ago, where they noticed that had multiple individuals on their website with a certain medical condition, and there was a new drug that was being proposed as a drug that would be helpful in that condition. So what they did is that they looked at all of the data that their members were sharing, and they analyzed that data after collecting it for a few months, and they were able to analyzing that data that was shared by members to say that they don't think that it looks like that medication is actually not effective. 2 years later, and after a multi-million-dollar study that was done by the NIH, they were able to reach a similar conclusion. So there was a lot of interest at that time in the potential for those peer-to-peer patient social networks to be able to conduct a new kind of research through their social interactions and with the intermediation of a company that is not necessarily in the traditional sense a healthcare company, but a company that facilitates this health information sharing among peers. And there was a lot of interest in thinking about what is the potential for this type of research. And some of the outcomes of that type of conversation, discussion, and reflection that happened at that time is that there are now some academic medical centers that are using social networking to conduct very large-scale research. There was recently an academic medical center in California that started enrolling for a trial that they said they would like to enroll 1 million patients in. Numbers historically unprecedented. It would be prohibitively expensive to have a clinical trial done in the traditional sense that would collect data from that number of participants. But with the availability of very cheap social networking, with the availability of smartphones and mobile devices, that scale of healthcare research can now be done. So that's another, social networking is another very interesting area that will probably be bringing a lot of change to healthcare. Another way that social networks are being used is something that is being piloted or tried by a company called Care and Sync, and it is another one that Margaret Loss shared with us, talking about the California Healthcare Foundation Innovation Fund. And the company Care and Sync, what they do is that they create something like a Facebook for healthcare teams for individuals. So if I am a patient, I can create my own mini social network that includes my family and friends who I want to be aware of my clinical condition, my healthcare providers, either my physician, my nurse, my care manager, my hospital care team, which includes specialists and hospital nurses and so on. And all of those individuals are now available with my permission and with privacy settings that are compliant with all the rules and regulation that governs patient information. All of those individuals are able to share information and with me and with others and be able to manage the clinical condition and share information that would help me take better care of my health. So that's another way in which social networks are being used, and social networking technology is being used to facilitate healthcare delivery and the care experience. Next are natural interfaces. There are new interfaces that are coming into healthcare to help healthcare providers do the things that they want to do, and in some cases even be consumer devices to help consumers. And what you're seeing there is Google Glass, which has recently been getting a lot of attention, especially in the inpatient setting. So surgeons being able to see in front of them at all times somebody's x-rays while they're operating on them, CT scans, in some cases even being able to project certain information on the operation field that would help a surgeon do the surgery that they're trying to do. So those types of things, and one of the big benefits, of course, to that technology is that it used to be that the surgeon would need to go to a screen or a computer to be able to look at this information, and sometimes they would have to interact those devices in a way that would potentially bring some infection or other risks to the procedure, and now they're able to have access to this information right in front of their eyes while they're performing the surgery without having to interact with any of those other devices that they used to have to interact with. Some of those natural interfaces are also going into the consumer space. So recently, the Nike Fitbit and the Microsoft Kinect, which are consumer level devices and technology, combining those, people are able to be given technologies and tools to help them do things like exercise. People who are going through rehabilitation after certain clinical conditions, they're able to use those devices, and it's an interface that provides them with real-time feedback on whether they are doing the right things, they are doing it adequately, and they're doing it as instructed to do it by their clinical teams. We talked about, I mentioned briefly that the $1,000 genome, and really genomics has been one of the areas where technological advances have been moving forward at an unprecedented pace, even with keeping in mind some of the other technologies. The first genome, the first human genome, was sequenced not that long ago. It was actually done in the 90s. It was successfully completed in the early 2000s. And the cost of sequencing that first genome was $3 billion. It used to be, it was a project that was funded by the NIH. It was performed at multiple academic institutions with hundreds of individuals with lots of very expensive technology, all working together to sequence that first genome. And now this machine that we're looking at from a company called Illumina, this machine is able to sequence a human genome in 24 hours or 2 or 3 days at the most at the cost of $1,000. So within 1.5 to 2 decades, our cost for sequencing a human genome has dropped from $3 billion to $1,000, and the time has shrunk from 10 years to a couple of days. And this, on the screen, what you're seeing is that the green line is actually the change in cost of sequencing a human genome from the early 2000s till 2013. And it starts, this is actually a logarithmic scale, and it's in thousands. So where we're starting in 2002 is $100 million, and where we are today is actually even less than what is showing on the graph, because again, this machine is able to do it at $1,000. The faint gray line that you're seeing is, the way that computer technology has been going down, which is Moore's law, and using Moore's law, with the technology that allowed us to take computers that used to fill whole buildings, and now we have a computer that is more powerful than that in our pocket, which is the smartphone. The way that genomics has been progressing is even a lot faster than that computer technology. So we can, from the way that computers have taken over everything in our life and has made it very cheap and very easy to communicate and to share data and to find information through something like Google, all of those changes and all of this reduction in cost and increase in power of computers, the way that genomics is moving forward is a lot faster than that. So, people like Howard Jacob, who is the director of Human and Molecular Genetics Center at the University of Wisconsin, says it in that MIT Technology Review that he really expects that the changes that are happening in genomics that will have a profound impact on the way that medicine is practiced and the way that treatments are discovered. Next, what we're looking at is the IBM Watson computer, and everybody became familiar with Watson when a couple of years ago it was able to beat the 2 Jeopardy champions, best Jeopardy players of all times, and the computer was able to beat them at Jeopardy in a 3-day match that was very widely publicized at the time. IBM then took this technology, and in the New York Times, they said IBM Watson goes to medical school, really in partnership with academic institutions like the Cleveland Clinic, like some of the cancer centers. They are taking this technology and they are trying to make the Watson technology be able to gather the clinical information, whether from clinical trials that are being generated at an unprecedented rate, or at the individual levels, all the information that we are collecting in electronic medical records in our hospitals and clinical practices. The Watson technology will be able to bring those pieces, different data sets together, and bring this information together to apply that latest and greatest technological advances and clinical discoveries to every individual patient. This will take some time to do, but some of the early results are starting to show up. And I think at Memorial Sloan Kettering, they just recently announced that they have a computer program that is now able to diagnose lung cancer at the same accuracy and provide feedback as to what the best treatment should be, is able to do that at the level that the best specialists at Memorial Sloan Kettering are able to do, and they are starting to bring that type of technology into practice. So I would suspect, and by the way, that what you're looking at here is what Watson used to look like. It used to, fill almost a half a floor at an IBM technology center, and they say that since that time, they have actually been able to shrink that technology to be the size of a half of a cabinet, and that tells me that it's probably going. It is definitely going to follow the same trajectory of improvement in cost and power that all of other computer technology has been following. And I don't think it's going to be too long before every physician has access to this technology, and they are able to utilize the power of all those new discoveries that are being done or that are being achieved in the healthcare field, they're going to be able to apply all of that technology to their patients by using the best expertise at those very large academic centers that are helping bring this information into the Watson technology. I think this is the last slide that is going to talk about some of the changes that are happening in the technology arena. And this is a company called Theranos, and what they have been able to do over about 10 years of research is that they are now able to run about 300 or 400 blood tests, lab tests, things that used to require a trip to a lab and a blood draw and waiting for a day or two for this sample to be processed, for the results to be available. They are now able to run those 300 or 400 tests from just 1 milliliter of blood, which is this small vial that you're seeing there. The size of the vial is 1/2 inch or 1.3 centimeters. And they draw a very small amount of blood through a finger prick. It doesn't actually need to be a regular blood draw through a vein. It's just the blood collected through a finger prick. And they're able to run those 300 to 400 tests and provide the results both to the patient and to the provider within 1 to 2 hours. Walgreens was so impressed with this technology that they have developed a partnership with Theranos, and they will be bringing this technology to their Walgreens clinics. And people will be able pretty soon to walk into a Walgreens, get a finger stick and a small amount of blood collected, and be able to run a whole huge amount of labs, any of those labs that need to be run based on either a patient's preference or a physician order, be able to run those tests, and within a couple of hours those results will be available. The other thing that is interesting is that Theranos says that they're able to provide those tests at half the cost that Medicare reimburses for those tests, which is already significantly lower than the cost that either individual patients or private insurers are paying for those tests. So this becomes a huge convenience factor. It becomes a big competitive threat to labs that are out there right now running those tests using technologies that are different and more costly to implement than technology that we're talking about here. I'll just pause here for a second, and I'll say that I'm not really sure whether all or even any of the companies that I just mentioned and the products that I have mentioned will be successful and will be kind of the solution to any of the problems that we were talking about. They definitely, most of them, look very promising. But the important thing to notice is that this kind of innovation and technology drive is definitely going very fast, and it will have a huge impact on the way that healthcare and the patient experience are seen in the healthcare field. This is a slide that shows the increase in the amount of venture capital that is being invested in healthcare companies, and it is one of the reasons that is driving those technological advances in addition to the technologies themselves having reached a point where they're having an impact on healthcare. Another presentation that we had in our webinars was Teresa Titus Howard, who is the Deputy Group Director, Quality Improvement and Learning and Diffusion at the CMS Innovation Center, and she talked about all of the innovations that are happening in the healthcare reimbursement field and moving from ACOs to comprehensive primary care reimbursement to bundled payments. Reimbursement is another huge driver of the changes that we're seeing in healthcare. This was another slide, one of her slides, and it was talking about the comprehensive primary care methodology. We had another presentation by Will Yu, who at the time was the Senior Director of Innovation at the Office of National Coordinator of Healthcare IT. Now Will is the Director of the Foundation for Health Innovation, and he talked about how the government is making investments in the health IT space to drive innovation and to drive change in the healthcare field. He talked about technology in the patient-centered medical homes, in accountable care organizations, in bundled payments, and readmission reductions. So what is, when we're saying that innovation is the solution that healthcare organizations need to implement, to deal with this tremendous change, this perfect storm of change that is happening. What does that mean? What do we mean by innovation? And what are the things that healthcare organizations on the cutting edge are doing today to implement those innovation methodologies in their systems and in their organizations? So that will be, the rest of today's presentation, talking about what is happening out there in those cutting edge organizations that are helping them become innovative and that we can all learn from, and other organizations who are interested in moving in that direction can learn from to become innovative. One of the presentations, again, that we have had was applying the discipline of innovation and design thinking in healthcare that was presented by the leadership of the Mayo Clinic Center for Innovation. Dr. Nick LaRusso and Barb Spurrier presented the work that they were doing at the Mayo Center for Innovation. And what they said is that they define innovation as discovering and implementing new ways to deliver better health. And I really liked that slide. I thought that it was a very simple but also very telling way of what they are thinking about when they're talking about innovation. It's not discovering something new and exciting. It's not a new technology. It is really delivering better health. That is the goal, and that should always be the goal of innovative projects. They talked about opportunities for innovation, and it's not just in the way that care is being delivered. They talked about finance, business models for delivering care. They talked about processes. What are the systems of care and care delivery? They talked about specific offerings, products, and services that are innovatively designed and delivered. And one of the things that at the Mayo Clinic they recently announced is that they are making a mobile phone, a smartphone app available where somebody can pay $49 a month and have access to Mayo Clinic nurses who have access to all of the Mayo Clinic protocols. So for $49 at any time through my cell phone, I can reach a Mayo Clinic nurse, tell them about something that is experiencing, or tell them about a healthcare question that I have, and be able to get some access. It's not access to, of course, the full Mayo Clinic knowledge and experience, but it's access to a significant portion of that through conversation with Mayo Clinic nurses. Jason Wong, who is co-author of the Innovator's Prescription, How Disruptive Innovation Can Fix Healthcare, and he was the co-author of that book with Clay Christensen, who many consider to be really the guru of innovation. He's a professor at Harvard Business School and has published a lot about innovation, from the Innovator's Dilemma and Innovator Solutions, books that are considered really the foundation of innovation in industry in general. Jason talked about how they are applying the disruptive innovation business model methodology to healthcare. They talked about telecommunication, precision diagnostics, information management, and decision making, and how that is really what they're doing. And what this diagram that we're looking at is telling us is that all of this innovation is really driving healthcare from a centralized location, which is the traditional picture of a hospital that we see here, is really driving that more to the periphery of the system, where it's happening in clinics and sometimes even happening in patients' homes, where that's really the drive of those disruptive innovative business models in healthcare, is to drive this centralized delivery of healthcare more to the periphery, and moving from what they call a solution shop, where there's really a huge amount of technology and a huge amount of labor that is being applied to solve clinical questions, to making it more algorithmic and more simplified to deliver some of that care. Not all of it will be able, of course, to follow this model. There's always going to be the need for a place where very advanced and very expensive technology to live, and where complicated surgeries can be performed. But a lot of the care that is today happening in large centralized healthcare bases can be driven to the periphery of the system. About a couple of months ago, Vinu Ulak, who is the executive director for the Center for Care Innovation, and George Su, who is an intensivist, a pulmonologist at San Francisco General Hospital, talked about how they are applying innovation in their organization. And they talked about the different parts, like a big machine, and most of that big machine that really needs to come together to deliver innovation is happening under the surface, where we can't really see it: IT, procurement, implementation, and the politics that come into innovation, the silo mentality where things are historically have been separated, and the way that academics and grants come together to bring the skills and bring the resources that are necessary to drive innovation. How understanding all of that and understanding it for somebody's specific organization, how that is very important to be able to drive innovation forward. A couple of months before that, Jim McGutter, who is the professor of design at University of Utah, talked about how important it is to bring all the different perspectives on what the patient's problem is, how to bring all of those perspectives from administrators to doctors to nurses and others, how to bring those perspectives into the innovative process so that when we're creating new solutions using new technologies driven by new incentives, how we can make sure that all of those pieces come together to come up with the best solution. That really becomes the question, is if there are all of those different stakeholders that need to come together to drive innovation, and if there are all of those different perspectives that are necessary to be brought into the innovative process, what are some of the tools, what are some of the methodologies that have been proven to be able to do that? And that really becomes the next part or the next point that I was trying to make earlier on in the summary, which is, what is it that an organization needs to do to truly become innovative, to truly be able to integrate all of those different functions, all of those different stakeholders, and bring all of those different perspectives into creating innovative care delivery and innovative experience solutions. I'll skip this slide. This was an experience of one community health system, Columbus Regional Health, and the individuals who we had presenting that experience were Lynn McGuire and Julia Bedian, who were both leaders of the Innovation Center at Columbus Regional Health in Iowa. And what they said is that they really started by assessing what they have in the form of innovation assets. They looked at the individuals that they had, they looked at some of the skills that they had, they looked at the resources that they had, and then they built a shared vision that they wanted to be an innovative organization, created a couple of pilots, and then from the learning that they experienced from that process, from running those pilots, from taking the inventory of what innovation resources they had available, they were able to then refine that vision for an innovation center, were able to attract additional resources and additional investments, and their experience has really been in using philanthropy to drive their innovation initiatives. And Julie, as the Columbus Regional Health Foundation president, was able to use philanthropy to attract the resources that were necessary. But it's really very important to start by assessing those innovation resources that organizations already have, and building that shared vision that we want to be an innovative organization. Another presentation that we had from Christy Zuber at the Innovation Consultancy at Kaiser, an organization that is many, many times the size of Columbus Regional Health. So they had an infrastructure that was much bigger, but they were still talking about doing the same things, creating innovations, being able to communicate the Kaiser brand, being able to cultivate innovators within their organization. And their infrastructure included methods, spaces. It's very important to talk about the innovation space, and I will share with you in a couple of seconds some of those innovation spaces that exist today in organizations. Using tools and technology to drive innovation, networks, creating the networks, and something like the Garfield Center at Kaiser is a place where those networks are created. Individuals come from across the system to connect with each other and to look at new ways that they can deliver better care and a better experience. So what does those spaces look like? If an organization wants to be innovative, one of the most important things is to have an innovation space, a place where those individuals who are interested in delivering better experiences and better delivery systems can come together. What we're looking at here is the Innovation Center at the Mayo Clinic. And you'll see that there are spaces in there where individuals can put their thoughts and ideas on the walls using either the design methodologies, design thinking methodologies, or some of the other innovation methodologies that are systematically taught and brought into those organizations. They can put those ideas and use those methodologies to work together for a period of time, not being impacted by the day-to-day pressures of just delivering care the way it's always been delivered, they can come together in those spaces and create some of those innovative delivery methodologies. This is the Innovation Center, Columbus Regional Health, and you'll see that there are a lot of the same ideas. It's open space, it is bright colors, it is glass walls, and it's an environment. The environments are very important in defining the way that we think and helping us think in different ways. So creating environments that are conducive to innovative thinking is one of the big factors in creating innovative organizations. The other thing that is really important in becoming innovative is to make sure that there is an innovative funnel, is that we do not come to closure or conclusions pretty quickly. You'll notice at Kaiser they talk about they starting with 400 ideas and then pruning and narrowing those down till you come down to about 4 ideas that are actually implemented. But it's really important to start with those very large number of different ideas, even the ones that are not very promising or don't appear to be very promising. Including those in the process helps drive everybody's thinking forward and might end up making a contribution to the final result. At Kaiser, they use the human-centered design approach, and you'll notice that it is described there. It's not really important, it's not really the focus today to talk about any one specific methodology. The focus is really on saying that we need a space, we need a methodology that we learn about as an organization and make sure that we spread that learning and that methodology is consistently used. This is a different methodology that they use at the California Center for Care Innovation. And again, the focus is not to go into the details, but they have created a methodology and they help spread that and they help stick with it. This is the methodology that is used at Columbus Regional Health. And they talk about their people, their places, their projects, their processes, and their partners. Again, not really the methodology that is really important, but the fact that there is a methodology, that there is a way based on others' learning and based on what has historically at other organizations been tried and been successful, is to come up with our own methodology and to stick to it so that we can become competent at that innovative methodology and we can start driving some of our ideas forward. Different methodology that is being utilized at the University of Utah: observe, analyze, ideate, prototype, and then once we have reached a successful prototype, we translate and we spread that idea. Again, from the California Center for Care Innovation, their methodology toolkit, including solution maps, facilitating reflective discussions, and affinity clustering. The last thing that I would like to spend some time talking about is really evidence-based design. And what evidence-based design is a methodology that was pioneered and continued to be spread by the Center for Health Design, led by Deborah Levin. Ken was one of the speakers, and what Winston Churchill is saying there is that we shape our buildings and afterwards they shape us. So evidence-based design really focuses, and this is the process, on how do we build healthcare facilities that support innovation and support the delivery of great care with the best possible outcomes. And these are some of the facilities that were created and generated using the evidence-based design approach. And I mentioned that in the section on methodologies because that's a different methodology, or that's another methodology that could be used by an organization that is interested in being innovative. And this specific methodology is more focused on creating healthcare facilities that are innovative and bring together the best ideas on how a facility should be designed and built to meet certain outcomes that are predetermined. The Center for Evidence-Based Design has a certification process in place, EDAC, which is meant for individuals who would like to learn, the evidence-based design methodology, and those who complete that process or that certification are able to apply that methodology to creating new healthcare facilities. Healthcare Innovation by Design is a partner with the Center for Health Design in bringing some of that learning. We are providing an introductory, one of the courses that I mentioned is an introductory course in evidence-based design. And those who find that that is something that they're really interested in can then move on to complete the series at the Center for Health Design and achieve the EDEC certification. How do we fund, innovation? The funding of innovation is really important, and the Center for Healthcare, the California Healthcare Foundation has an innovation fund. There's the CMS Innovation Center, and they have innovation grants. There are, organizations that use philanthropy, like the Columbus Regional Health. So it's really important when an organization is trying to be innovative. Building the spaces, defining the methodology are important, but also finding where the funding and the support for those innovative projects is going to come from till they become self-sustaining, until they become part of the way that the organization delivers care. So if all those pieces come together, what does an innovative product look like? And we had the presentation by Peter Jones from the university, from OCAD University on Toronto, and he's the author of a book called Design for Care that talks about all the things that we're talking about today. And he worked with the Mayo Clinic to apply many of those ideas that we're talking about, from social networking to new technologies. And they were able to, by bringing all of that together, they were able to create a new way for delivering care to expecting mothers, and they called it the Mayo Mom program. And it was really the creation of peer-to-peer networks between mothers who have had children and have raised them and have gone through the difficulties, and some of the expecting mothers who might have certain difficulties, might not have all the resources that they need. And by creating a technology platform that connected those mothers together, the Mayo Clinic was able to provide the support and to provide some of their resources to create that social platform that helped their community, helped their environment, helped those expecting mothers without having to necessarily utilize a lot of very expensive healthcare resources and healthcare professionals. And for those who want to learn more about that program, I would definitely recommend Peter's book, Design for Care. So that's what I have to talk about today, and I'll turn it back to Andy to summarize what we were talking about today, and I'm happy to take any questions. We almost used the full hour. It took me a little bit longer than I expected. It was really great to be with you, and if there are any questions that we can't get to today, I'm happy to answer those either by email, or you can easily find me on LinkedIn as well.
Thank you so much. Sam, can you hear me?
I can.
Wonderful. That was an absolutely wonderful presentation. And I want to pull it together so we wrap up pretty much on time. The most interesting thing is last week I had to speak to a board of trustees for a medical center that we've been working with for some time about the trends from the trenches. And they are a little behind what you're seeing. And my job was to help get them up to speed about what was happening. So as the medical center begins to adapt to changing times, they begin to understand it. The inclusion of the consumer is so incredibly important, and we're seeing it all over. So some themes that I picked up from you is the nature of a doctor and a consumer or person is shifting, and who does what to whom is changing, which was really interesting. The peer-to-peer part I thought was very, very fascinating. Including the consumer in the whole innovation process is going to be interesting, because as the generations change, what Gen Ys need, and even the next one coming, and how they interact is going to be part of the great transformation. Because if they love those little bands that I wear, the Fitbit, we begin to look at ourselves and our daily life in very different ways. Time. Simple, easy, faster is coming almost on such a short curve. It reminds me of what we used to call fads. It emerges, it surges, and it's purged almost before it becomes the way we do things. I love the Walgreens story where retail is getting into those fast tests. And boy, will that help people on Coumadin and other kinds of drugs get their results quickly and know what's happening. The challenge, I think, for all of this, as much as I like Jason Wang's image and I love Christensen's kind of work, is that change is pain. People hate to change, and the brain hates it. And so as we learn new things, we really do need that process, because once we put a map into place and we know where we're going, we relax and allow it to happen. But we're very habit-driven kinds of people. There's data, there's information, and there's insights. I'm anxious to see how the data turns into information and insights and how we test along this methodology to learn what's going to work so that the Mayo definition of innovation to give us new ways to be healthy and stay that way become real. I must tell you, I have too many client situations, whether in health management or in chiropractic or multi specialty services or healthcare hospitals, who are trying to figure out what to do and are getting stalled in the process. Their brains really need a process for doing this. My wish is that you have seen, felt, and thought in new ways before you can do things. And I hope we can help you through this series to begin that journey. We are going to pause our webinars. This is our 8th webinar, and the attendance and responses have been terrific. We're going to pause for the summer. In the fall, we have Chris Baird coming on in September talking about the changing patient experience, which you will look forward to. She does an enormous amount of mystery shops to see what really is happening. Joe Beccalori is going to talk about creating healthcare web experiences that work. Ben Dillon told you 42% of the hospitals are changing their websites. What's really working here? David Marlowe is going to talk about accountability in changing times. In January, Corey Smith will be talking about inbound marketing, health grades, and what we're seeing happening as consumers are changing how they find solutions. And Kenya Gibson from Franklin Street will be talking about the new patient persona. And I think Kenya is on with us today. So I can't tell you how much I appreciate Dr. Sam Basta's time. He's done a fabulous job. And for all of you who have joined us for this, our 8th webinar in our webinar series. As always, our slides will be attached to the audio and put up onto YouTube. So you can listen to them. And on SlideShare, they will be able to be downloaded. You can always ask either of us for more information. Because of time, I'm going to eliminate the question period, but I thank you all for joining us. And that's the story for today.